myself so you have a little bit of context about where I'm coming from and why I'm asking the questions that I am. So I was introduced as a user experience architect at Intel. I work in Intel's Health and Life Sciences group in the Innovation and Pathfinding small team that we have within the Health and Life Sciences division. I'm also a medical ethnographer and have been doing ethnographic studies across the continuum of care for the last 11 years now, with the idea of translating information by shadowing clinicians in hospitals, home health nurses, doing ride-alongs with them, looking at telehealth, looking at care management, basically looking at everything across the continuum of care in terms of how work actually happens, as opposed to how we think it happens as technologists, and trying to take insights from that and translating that into next generation healthcare information technologies that get operationalized in the practice. So I'm also an angel investor, so I have a lot of interaction with technology companies that are trying to bring new technologies across several verticals, but specifically interacting with ones that are trying to bring technologies into the healthcare vertical. So the orientation that I have that's sort of informed this workshop is this whole idea of really sort of working at the intersection between the realities of what people actually do and are willing to do, both clinicians, persons, or patients, depending on what your context is, and on the other side, working with a huge technology company and working with startup entrepreneurs, that are really trying to bring technologies into the healthcare environment. So this duality between what are people actually willing to adopt, use, pay for, and then technology companies really trying to say, wait, we've got all this great technology, and wouldn't it be great if? And I wanted to kind of talk about this very sort of emerging area around IoT, Internet of Things, and analytics. Didn't hear a lot about that in the sessions that I've gone to in the conference, but that didn't surprise me, which is one of the reasons why I wanted to have this workshop, quite frankly. One of the questions that I'm kind of wondering about is, when you think about the progression of technology, specifically health IT technology, I remember when I started back at Intel's Digital Health Group in 2005, most of the healthcare providers that I studied weren't even using electronic health records. 10 years later, now, it seems like, okay, for the most part, if you don't have an electronic health record, that's a little strange. But it kind of feels like they're just at the cusp of really taking advantage of having an electronic health record. And so here we are, companies like Intel and Qualcomm and you name it, and all kinds of startups are saying, oh my God, the future is IoT and big data analytics. And that's the message that's sort of being promoted with healthcare providers, and the healthcare providers are standing there with sort of like deer in the headlights saying, wait, IoT, analytics, what are you, crazy? We're still trying to figure out how to use the EMR system. Now, you might say, well, gosh, that's not really true. Give me a break. It is true that in the area of personalized medicine, precision medicine, genomics, and that sort of thing, analytics is huge. Why? Because the data already exists. It is true that analytics are being applied to EMR systems. Why? Because the data already exists. But if you're talking about IoT, a little bit of a question about whether or not the data really exists to really have a meaningful conversation, or to actually be able to talk about a very strong proposition, a value proposition around analytics of IoT data. So that's the conversation that I actually wanted to have with you guys. Because I sit around and think about this stuff all the time, and I say, gosh, wouldn't it be cool, I told Prannoy, wouldn't it be cool if I could actually have a workshop where I could sort of crowdsource what you guys have been experiencing, thinking about doing. I'm an ethnographer, so I'm more into what actually is happening as opposed to what we're thinking about could be happening. So I was interested in sort of leveraging your experiences with this dilemma, which I'm going to sort of tease out a little bit more. So I found this graphic that was created by it was on the Institute for Health Technology Transformation website, this patient room of the future. And I love this graphic because it so well represents the technology sort of perspective of IoT and the opportunities, and oh, wouldn't it be great? So I titled it Our Vision in terms of everything is connected. You know, I went to HIMSS in Las Vegas and everybody was talking about connected care, connected care. Everybody was talking about IoT and analytics. But then when you talk to the providers that were there, and there weren't that many providers, it's mostly an HIT conference, you know, providers say things like, gosh, I don't even know what we're going to do with that data if we had it. You know, I don't understand the value proposition behind this. And then the more interactions we've been having with healthcare providers, because one of the things that Intel is trying to do is try to bring IoT and big data analytics into the healthcare space, the more I started to realize, you know what? What is the fundamental barrier that I seem to be hearing from healthcare providers? And you know, the conclusion that I've come to is it's actually not a value proposition question so much right now to me. I mean, obviously there's a question about the value proposition, but it almost seems like we need to step back a little bit and say, you know what, are they even at a point where they can even talk meaningfully about value proposition around IoT? And I try to use an analogy. It's almost like back in the early 90s trying to talk to companies about applications that would run on a computer before they even had Windows. It kind of feels a little bit, that's an extreme example, I have to admit, but it sort of feels like there's not enough of a foundation in terms of an IT infrastructure. It's difficult for healthcare providers to really think in terms of how do I actually operationalize IoT into my environment so that I can actually do something with it. Let alone what kind of questions can we answer with this, and then what's the value proposition behind it, what is the ROI around adopting this kind of technology in the healthcare environment. So one of the things that I wanted to posit is that based on observations that we've been making, that healthcare providers are really struggling to integrate new point solutions into their existing IT infrastructure. And I emphasize the words point solutions because there's a proliferation of point solutions in the ecosystem right now. And a lot of them are very good. There's no doubt about that, but from a healthcare provider's point of view, they're just being bombarded by all of these point solutions that they say, wow, you know what, that's great. But they're getting to the point where they've reached saturation in their ability to provision new technologies into their IT infrastructure. So it seems like it's kind of coming down when it comes to IoT and being able to leverage analytics based on IoT data. It seems like there's a barrier that's associated with the IT infrastructure that is related to being able to provision new point solutions into the existing architecture. I mean, the kinds of things that we've been hearing is that, you know, there's competition for limited IT infrastructure within the IT space, within a healthcare provider's environment. There's competition for physical space. If you think about it, the inpatient environment, those rooms do not have an infinite amount of space to accommodate new devices, new kind of spaces that you have to have just to be able to interact with those devices. So there's a physical dimension as well. They're costly to integrate. They're not easily integrated into with other apps, and there's a lack of interoperability. These are things that we've been hearing over and over and over again. So when we're thinking about trying to push, I'll use that word, IoT and analytics based on IoT into the provider space, we're starting to realize that we really need to help providers deal with this IT infrastructure problem, because that is the foundation upon which this adoption is more likely to occur. Okay, so what's the big deal? We believe that if we're not able to help providers easily integrate new technologies into their IT infrastructure, we're not going to be able to facilitate widespread adoption of IoT and analytics. So we're kind of looking at a different problem. So what I wanted to do in the time that we have remaining is, you know, there's a lot of people in here. I see the gentleman, I think, from Microsoft, right? Okay. And actually, you gave a pretty interesting example of use of IoT. I think you were the one that talked about the buses.
Yeah, it's interesting.
Right. Yeah. The one that talked about, but that's a different sort of context. This is more like the intersection between environmental sensing and health. But what I wanted to do is kind of engage a conversation with you guys about what are you saying in terms of drivers and impediments to IoT adoption and next generation patient care. And I want to kind of broaden that, and I think a lot of it was kind of informed by some of the examples we heard at the opening keynote, and that is not just kind of thinking about it sort of in a limited sense in terms of there's patient care that happens within bricks and mortar facilities, but then there could be opportunities that are more related to sort of adjacencies like environmental sensing that actually informs care that has implications for population health. So I just wanted to kind of open it up. You know, let's have a conversation about what are you guys seeing in terms of providers that can be, you know, community health providers that can be focused on population health, safety net providers. What are you saying in terms of IoT adoption within that space? I think we need to have, oh, I guess I'm the one with the microphone.
I am a physician in occupational medicine. I practice at Kaiser. And I think, you know, one of the barriers to adopting technology for primary care doctors or for doctors in general is that technology actually adds more work to their regular workflow. If you can convince doctors actually, you know, your technology can help them save time, I think you're going to get a lot of people on board to use your technology.
Can I, one thing that I did want to kind of stress in this particular workshop is, so IoT technology has certain attributes that I'm kind of trying to push on a little bit. This whole idea of, if you can imagine a bunch of connected devices and sensors and that sort of thing that are in and of themselves generating data, that you could potentially apply analytics to. So we're talking about virtualizing or being able to capture data about events, states, context, that kind of thing, which is data that is actually not being captured right now.
Right.
And the potential to actually connect those data to one another. That's the kind of technology that I'm talking about in this particular workshop. So specifically IoT technology. So.
Yeah, so I'm from Stanford Healthcare Digital Solutions, and so here's the perspective that we look at as a consumer of this technology, and I've seen quite a few pitches in that regard. So EMR overall is most of the times the documentation is after the fact. And what IoT should be focusing on, and again, I think it talks about what you were just trying to get to, and the theme of the conversation here is that there are two types of interventions IoT can make. One is passive, one is active.
Right.
So providers are more open, at least in our organization, towards passive interventions. Passive, efficiencies that can be gained. So at one of our cancer centers, we are using real-time location systems. They are IR based, but then right now we're looking at other possible technologies to do that triangulation via the Cisco routers, applications-owned devices. So, if you tag a resource and then you drive clinical workflows based on that, folks are very open towards it. So the physicians, the providers, even the patients. I mean, we initially thought when we were trying to introduce location-based tracking in our cancer center and deeply embedded in clinical workflows and for the patient as well. We were expecting some pushback, not just from the provider community, like the big brother effect, but then also from the patients, like, hey, I don't want to be tracked, why are you doing this? But then some really poor patients, like a very different demographic which you're expecting services from, they were open to it. And then similarly, providers, once they saw how quickly we can turn around their clinic visits compared to the lack of that technology and how you can automatically drive communication, flip the statuses of the rooms from clean to dirty and the other way around, and then make staff assignments, and then for the patients to be able to not go and check themselves in for every visit at every floor, because if there's a cancer patient, they're likely be going to 2 or 3 different places in the building. So if you can centralize that for them, everybody appreciates, and it works. It works. So, I think the key is, as much as possible, if you can make it passive, that eases the adoption.
Okay, that's an interesting perspective, passive versus sort of, the way that you define active would mean, I just want to make sure I understand your definition of active in order to make that contrast.
So active means like you're expecting them to do something.
Like log into a system or do something, or like
Got it.
click or like
Got it.
surf to a certain
Okay.
application and do something. So those things help, like for example in behavioral health, or like like an MA clicking their button can
Right.
on a tag can mean a certain thing in the workflow, but then that should be pretty much the boundary of the
Right.
press a single button, you know exactly where to go. If you ask them to do more than that, log into
Right.
a system and like a separate system outside of the EHR, then they're not going to be as open towards it. So as little as possible, then there are still so many efficiencies you can gain, and the ROI is immense.
Okay. Does that sort of address sort of where you were coming from? Got it.
I
Okay.
think, a lot of healthcare providers, they have this mentality, I've been practicing, we've been practicing medicine this way for centuries or decades. If it's not broken, why fix it? So
Yeah.
if we can break that mentality, that's going to be huge. If whoever can solve that problem, they're going to, make the next huge technology.
Yeah, well, that's an interesting one. What about, there was something that I heard in another session about one of the reasons why it's hard to actually sort of drive adoption of new technology, and in this case we're talking about IoT technology, and I've certainly observed this, is that providers are really busy just trying to keep the lights on. It's not like they step back and say, well, let's take a break and sort of think about how we can actually adopt new technology. The patients keep coming in the door, you kind of have to keep servicing those patients. So what is anybody seeing, or what are your thoughts about, given the realities of the fact that healthcare providers have to keep the lights on in terms of patients just keep coming in the door, and it's hard for them to come up for air, what have you seen in terms of that as a potential barrier, or have you seen some ways of sort of working around that in terms of adoption of new technology? Does anybody have any observations on that?
Well, I just want to say from my experience that there's a lot of value in piloting change before you try to implement wide-scale change.
Right.
And I think that if you can demonstrate a positive impact or a significant impact, and starting small allows you to figure out what the workflow is, and gives you time to evaluate, make improvements, and that way you can have more success when you try to spread out. But I think if there's opportunity to start small, that's really
Yeah.
valuable.
We can have a whole workshop on pilots in healthcare, because that's, from a technology, let's say a startup company's point of view, when they come into healthcare, that's the first thing that they hear. Oh, we have to do a pilot. One of the things that's kind of interesting when you think about healthcare is really, yes, you have to do a pilot, but then what's really important is how do you actually convert the pilot into an operational implementation, because, I could talk about that forever. But anyway, you had a comment that you were going to make.
No, I'm agreeing with a lot of the comments here. The one thing that I see though is, so I'm a nurse who's been in healthcare for like 24 years. And when I first joined a startup, I was working with a software engineer, a data analyst, I was a clinician, and working with an architect. And it was taking that approach, and unfortunately in health systems, they're so siloed. Most physicians would love to use technology, but they don't want technology that's looking for a problem. They want a problem looking for a solution.
Yeah.
And so, I worked for a previous startup that was designing software for architects who build healthcare facilities. So taking that workflow, data-driven approach and designing the building around that. And what I found, though, is that so many physicians would love to have had an IT person just follow them around and understand their pain points. Like you'd have 5 faxes in the ER, and each fax had a different computer that would send it, and they couldn't integrate it. It was such a simple solution, And there's so many of those low-hanging fruit, but unfortunately IT in a lot of places is so disconnected from the clinical.
Right.
And that was the one thing. And then the other, I'm trying to think. Yeah, that was just one of them. Oh, and what I was going to say about your comment is, so, you know, there's Intelligent Insights and what Intel's doing and stuff, and these are good companies, and there's so much opportunity for the Internet of Things, but they need to partner with the lead promotion offices, because what I found too is when I would access the EMR data to do performance improvement projects, the timestamp data was not correct. So you may have like the point that they actually got registered, but you didn't know when they got roomed, or it wasn't an accurate data, and then you have when the doctor put the order in, but not when they were discharged. So having the Internet of Things, being able to track you know, the band, where if, you know, one-time registration and you basically have all those touch points, because that's more effort for the clinicians to have to log in for all those time studies, but you get more accurate results. But unfortunately, those departments don't really have a budget to buy that technology.
Right, right.
I think that's one of the things that we encountered, you know, when we were looking at technologies, and I think that's the request to the industry. Again, I'm a consumer of technology, you know, my organization is an academic medical center. Then right now, the technology that you just referenced and the one that I just described is very infrastructure heavy. So you have to have sensors, IR sensors embedded in the ceilings. Everywhere you want to track it, and these are IR sensors. If you flip them over, the accuracy goes haywire. So essentially try to make, I mean, that's exactly what we're talking about, you know, try to make it as infrastructure light as possible. Those timestamps are easily achievable, you know, and we're already doing it and very, very accurate. But, you know, what it takes to get to it, and we are currently in the process of doing an ROI study on our cancer center. And it's difficult because the way we did it is like, again, something that you mentioned, we designed the building keeping in mind that we are going to have this technology there and which use cases make more sense. And then we wanted an on-stage, off-stage concept, and we wanted a decentralized registration concept. So we designed the building, the workflows accordingly, and it helped with the adoption. But then again, you know, the future should be as infrastructure-like as possible. The footprint, the requirements, the core requirements should be piggyback on the network, piggyback on Wi-Fi, you know, and try to gain that level of accuracy to say, okay, this resource, this patient's own phone, mobile, or whatever that, you know, MAC address might be, you know, that level of granularity right now is I think 3 feet by 3 feet or 3 meters by 3 meters, but then that needs to get more and more granular to the chair level. If you want that chair level data, that, you know, you're looking at like these sensors up in the ceiling, which is expensive.
Right, right, that's right. Does anybody else have any other experience with that? That's an interesting concept around sort of piggybacking on existing infrastructure that's in the room or in the facility to try to make it IT light from an adoption point of view. Does anybody have any other experiences with that? Go ahead.
So I can take a whack at that. Partially, I think it comes to... So I think there's a lot of interest in how do you piggyback on top of some existing infrastructure, but a lot of that infrastructure is consumer-grade infrastructure and not designed for a lot of the environments in hospitals and what sort of the reliability is needed. And so you sort of get into an impedance mismatch between what we in the tech side and the cycles that we're used to working with. And you know, if my Fitbit crashes, it's not that bad. But if my wireless pacemaker gets hacked, that's a sort of a different level of risk. And on top of that, you'll add a sort of a regulated industry that has much longer certification cycles. And so we can sort of set an expectation of what we see in the consumer world that the medical industry, from my tech standpoint, can't and probably shouldn't keep up with.
Yeah. So to that point, does it feel like IoT is too early for healthcare at this stage? That's a provocative question because if you went to HIMSS, that was assumed. But I just wanted to ask the question, does it feel like it's too early right now? What do you think?
I think the patient expectations are there. I'm speaking from a patient perspective design. The patient expectations are there. what they can do with that data and being able to diagnose something is available online, and then being able to have that kind of expectation from the service providers. That's already there.
We just, so is it too soon? No. People know that we can track them, people know where they're going. I mean, they're sharing some of the data. Telemedicine is here, so from a consumer perspective,
So it sounds like what you're
it's not soon
saying,
enough.
you're saying that from a consumer perspective, it's sort of like, yeah, we actually want this, but on the provider side, it doesn't feel like there's really enough, capacity or understanding or what to
But there
really.
is multiple pieces, right? It's not only about the capacity from that. Like now I know that I did not trust my physician to diagnose me at a certain way, so I'm going to read it up online and then go and tell them, which is annoying to the physicians. And anyway, it's an add-on to them in terms of now you're going to ask me these questions, which were not something they were expecting. So I feel there's an infrastructure problem in terms of its data. It will take time to get there. It's not easy to get there. FDA clinical cycles take about at least minimum 7 years to kind of at least get the pilots approved and all. It's just, we have to figure out how our policies and how our regulations and everything can make it soon enough. But we can also look at the systems level design of this to think about what can we provide sooner and what is it that we need bigger infrastructure for. So at least meet consumers halfway, where at least in terms of diagnostic and at least in terms of how the data is handled, is at least on a regulated platform. Everything else, geo-tracking and all, try to kind of do it outside of that. I don't know.
Yeah.
That is a discussion by itself and a workshop by itself.
I have a follow-up perspective on that. So,
Wait, who's that? Okay.
I have a follow-up perspective on that. I don't think it's too early for IoT devices, but I do think that there's a gap and therefore an opportunity to be able to aggregate data even for patients. We're all tracking and quantifying data from various different devices, and depending on what disease state you have, you may be using different mobile health devices for it. We don't actually have one common platform where we can aggregate all our data to then be able to, so it's broken from two perspectives. It's broken from a patient experience perspective, it's also broken from a provider's perspective. So a provider, it's not that a provider doesn't want the IoT data, but they don't want it in the form of one patient has a Fitbit, the other has a Misfit Shine, the other has another, and then on top of that, I also want to be able to track my wellness FX data for all my blood lab work, and so various people are using various different things. If the provider could see it all in one aggregated platform, that would make sense for both the patient and the provider, where you're not just looking at streams of data, but you're actually just helping them figure out the signals that they need to really pay most attention to, versus just, I think today what's happening is we're all generating a ton of noise, patients don't know how to make sense of it, and then we just expect our providers to just look at all this noisy data and somehow be able to interpret something from it.
Yeah.
So I think that's where, I don't think IoT is too early, I just think that we haven't developed a platform to aggregate and analyze that yet.
So I'm getting the warning here to stop, but I did want to ask you guys, show of hands, how many of you ever heard of the Open Connectivity Foundation? Okay, so that's actually an open standard that's been developed specifically for IoT to enable interoperability within the IoT ecosystem, and I think that kind of standards move is going to be pretty fundamental to being able to kind of achieve the scale and the value that you just got through mentioning. So I wanted to kind of make sure that people are aware of that, because it seems like it's very much going to be a standards based play that's really going to enable a lot of the ecosystem enabling here. So anyway, I just want to thank you guys for lending your ideas and your thoughts, and we'll see you next time.
Thank you, Monique.